Well, hello and welcome to all of our delegates from around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to everyone who's listening in today. A very special day today as I get the opportunity to sit down with Dr. Sarosh Rana. She's going to be here of course, at our upcoming Gold Obstetrics Gynecology Online Conference 2019. And as you can see on your screen, it's going to be talking about angiogenic factors and preeclampsia. So welcome to you, Dr. Rana. It's wonderful to have you here at our Gold Learning Obstetrics Gynecology Conference.
Thank you, Fiona. Yes, I'm very excited to be here as well, and welcome everybody.
Yeah, I mean, so we were just talking offline, Sarash, about how important this topic is and all the things you're doing. I can't wait to sort of dive in and learn more about what you're going to be sharing with us throughout this conference. But first of all, I would love it if you would just tell us a little bit about what your life looks like on a day-to-day. Where are you located in the world? Because of course we have an international audience here, so perhaps you can share that and tell them what you do. Where are you located and what are you doing on a day-to-day right now?
Great. So my name is, like Fiona said, is Sarosh Rana. I am an obstetrics and gynecologist. So I do high-risk maternal fetal medicine. I'm actually originally from India and did most of my training there. And then about 20 years ago came to US. Currently I'm at the University of Chicago and I'm the section chief in the section of maternal fetal medicine. So I got interested in preeclampsia, which we'll talk more about. It's a hypertensive disorder of pregnancy. Actually, way back in India, when it is one of the most common
Mm,
problems that we encountered. And a large number of women, even today, are dying from complications of preeclampsia. Um, Before I came to Chicago, I actually did my training in Chicago, and then I was a fellow at Brown. But I worked in, and we'll show that data as well, in the lab where we discovered, I didn't discover, but the lab discovered these angiogenic factors. And as a clinician, I then got involved in figuring out how we can use some of these proteins and biomarkers to predict adverse outcomes in women
mm.
who are going to develop this disease. Um, so I'm a clinician. I actually see patients in my clinic. I run a
Right.
hypertension clinic. I deliver babies, so I do C-sections and vaginal deliveries. I do ultrasounds, but I do spend a fair bit of my time doing research.
Right, right. And of course, a very dedicated teacher, it says in your bio too. So I imagine that you have a lot of residents and students that you get to mentor and teach as well.
Correct. Yeah. So students here at the University of Chicago, residents, fellows, even junior faculty, and I have
Oh, wow.
a whole host of international people also come through the lab here, and they come and they learn. And for example, India, I've been helping them develop even educational programs back home.
Oh,
So yes.
amazing. That's amazing. Yeah, we've been very privileged to work with several people actually from India, Sarash, in the medical field there and maternal child health, and it's actually amazing some of the research that they're doing there, and the outcomes that they're getting, especially in areas that have low resources and those types of things. So it's very fascinating and it's great that we can share that information globally with each other in the research field for sure.
Correct.
Yeah, it's amazing. You were just chatting offline, actually about, excuse me, about Dr. Neil Shah and how you first met him. And of course, he's our opening keynote at this conference at Gold Learning. So tell us a little story there.
So he was a student actually at Brown when I was a fellow in maternal fetal medicine. So then he went on to do his residency, and he works at Beth Israel Deaconess right now
Hmm.
which is where I worked for almost 8 years after I finished my fellowship. So we kind of never worked together. I think he joined in 2014. That's the year that I left BI and I came here to
Right.
Chicago. But he's a dear friend, and obviously he's super smart and he's doing all these fantastic initiatives. I'm very, very proud of him.
Yeah, yeah. Well, we're very excited, of course, to have him be part of our Gold program here. And we'll talk a little bit more about his presentation as well coming up, because I want to make sure that all our friends and colleagues get an opportunity to come and listen to him as well.
Mm. And he's
So,
a great speaker. I have
yes,
heard him.
no,
Yes, he's a great speaker. He's obviously very, very passionate as well about what he's
sure.
doing.
Yeah,
Absolutely.
yeah, no, that's wonderful. All right, so let's talk a little bit more about, the actual some of the things that you've been looking at, because this is very interesting. This is, a predictive way of learning about, what's happening with preeclampsia. So, what are some of the updates, or what are some of the things that you can share that you've sort of really been able to dive into, Sarosh?
Yeah, so I think what through the course, and we'll talk obviously when we do the session, um, but kind of the big picture is that we have now recognized as a research community that preeclampsia is placental disease. So it
Hmm.
essentially arises because of an abnormal placenta.
Right.
And then essentially the realm that we are working in is that a diseased placenta then secretes some of these proteins that then go ahead and cause all this maternal dysfunction. But you
Mm,
can measure these proteins in the maternal blood, and they
right.
are much better predictors, for example, for outcomes and for diagnosis than some of the traditional clinical factors that we use, such as measurement of blood pressure, measurement of proteins in the urine. So
Mhm.
we have identified some of these biomarkers, the angiogenic proteins, that have now large studies have been done outside of US as well, showing that they are good predictors of adverse outcomes. So yeah, so a lot what I'll talk about is how we kind of came about as a clinician, how you can potentially think of to kind of take this protein that was discovered in the lab from bench to kind of bedside. So how do you use this information that they are available and ultimately, obviously, to improve care?
Sure, absolutely. And so these markers, is this something now that you would see putting into a standard practice, or something that you would do that you would put into, that every woman should get? What's the guidelines that you're looking at right now?
Yeah, so good question. So in US, these markers are not approved by FDA yet.
Oh,
And I'm going to talk about that a little bit too. So for example, we are actually currently doing a study for the FDA for submission. Hopefully that'll be done in the next couple of years. Um, but there are, for example, the biomarkers are currently being used for prediction in the first trimester. I don't talk about it much, but there's been used, for
mm-hmm.
example, in Europe for prediction of preeclampsia in the first trimester, and then giving, for example, patients therapy such as aspirin for prevention of preeclampsia.
Right.
What I feel, if you ask me, how I, as a researcher who's done these large, kind of prospective studies, I
Yeah.
think there's a huge potential to be used in the third trimester. So that's when the patient comes in with some sign and symptoms of preeclampsia,
Yeah.
for example, to the hospital, or she's being admitted, and at that time use the test to triage her to see if she's at high risk or not.
Sure.
So essentially, you can use it as a rule out test to
Yep.
kind of reassure the patient and tell her, well, I know you came in with some symptoms of preeclampsia, but you actually don't have the disease. But I'm
Mhm.
going to show some data that in US, because the maternal mortality is actually going up and preeclampsia is a major contributor to that, I think it can also be used as a rule in test to actually identify patients who are at risk for adverse outcomes.
Mm, so important. It reminds me of, and of course, working with some of the clients, I have seen, as part of, working as a doula, I've had maybe a handful of clients that have ended up with HELP syndrome, which is very serious. And my most recent client, it was a few years ago. I'm not working actively with clients anymore, Sarash, but it was very scary because not recognized right away. But she certainly had symptoms, and they did catch it in time. But it's one of those things that can come up very, very quickly and can be very serious. And so this work, in some respects, must be very rewarding to you because you know that you're reaching new levels of knowledge and understanding. However, just getting those diagnoses in as quickly as possible to help those families is still quite serious because lives are at risk here, and we do lose women in these
Correct.
situations, right?
Correct. Yes. So 100% agree with everything that you said. It's
Hmm.
obviously very, very rewarding that we are working towards something. And,
Hmm.
it's been literally decades before any test for preeclampsia. There is nothing that exists. So I think just working on something that may potentially obviously be useful in clinical practice. And of course, more studies have to be done and trials need to be done, but just having the opportunity to be able to work on something that will actually benefit the patients. And you're right, the lives are being lost of women who
Mhm.
are not identified properly in time. And I have some data that people have looked at it in California that a large majority of women who died from, especially for preeclampsia, it's a lot of it is misdiagnosis and delay in diagnosis.
Right.
So yes.
Yeah. Yeah, this needs attention, and it needs attention now because potentially we could save lives. Do you know, I mean, like this is something that is life-saving. And if the research goes well and continues to get pushed through the FDA, it could be something that saves another, pregnant person's life. And that one person could be our daughters, our sisters, our aunties, whoever it is, and it could be someone that we know. So this is really good, and I mean it's so amazing to have you work in this area specifically. Knowing and having clients in the past that have suffered from hypertension as well, and some of the more serious conditions like HELP syndrome. So that's amazing. Well, I'm really looking forward to this presentation. I'm just going to take the screen here back to the beginning just so that we can have a look at our title slide once again. I saw that you were just flipping through the slides there and showing us a bit of a sneak peek there of the slides, which is fantastic. But thank you so much, Dr. Sarosh Rana, for being with us here today. It's fabulous talking with you.
Thank you very much.
Keep up the good work until we meet again, which will be very soon. I'm very excited. We'll be having you live at our Gold Obstetrics and Gynecology online conference starting on November 4th. That's right, folks, coming up really soon here. And we'll be opening up this conference with Dr. Neil Shah. That's right. He's going to be our opening keynote. Now, the big news I wanted to share with you is Dr. Neil Shah will be open access and free to everybody. So everyone will be able to come and join us for his presentation on November 4th. So no matter where you are in the world, you'll be able to come and register and access that for free. Also, of course, our closing keynote with Dr. Wendy Jones. She's a pharmacologist, and she's going to be talking about pharmacology and breastfeeding. So another great topic as well. And there you can register for a conference. Early bird registration is open, where you'll be able to listen to Dr. Sarosh Rana and many more wonderful presenters and speakers alike. So thank you once again to Dr. Sarosh Rana for joining us here today. And of course, to all of you, our listening audience. We'll see you all again soon. Bye-bye for now.